In your diabetic diet, you have to include your proteins like legumes, grains, pulses, etc. That's a major source of protein. If you're having a low pressure, then you tend to feel giddiness, and then you might fall occasionally if you're standing for a longer time. That is something which you have to be careful about. Hello everyone, I'm Dr. Ashwathi Soman. When we're talking about BP, that is the blood pressure of a person, the normal blood pressure usually tends to follow in the range of 120/80 systolic but diastolic, 120/80. But for some persons, it might go above 140/90, or it might go below 90/60, etc., or like 100/70, etc. So if you're having a low pressure, then you tend to feel giddiness, and then you might fall occasionally if you're standing for a longer time. That is something which you have to be careful about. If you're having a low blood pressure, then make sure that you add some more salt in your diet, and that can help you benefit. But if you're having a high blood pressure, please, you have to cut down your salt consumption, and then you have to have exercise in your daily life routine. Then only you can maintain the blood pressure. The same, the similar condition what we see is blood pressure. If you're having a blood pressure problem, then you might tend to have a diabetic problem, and then you might tend to have a cholesterol problem. Cholesterol, usually you have a diet plan, you have to keep up a diet plan. Then some of the types of cholesterolemia, hypercholesterolemia, is actually a familial condition. In some cases, a diet and exercise are helpful along with medicines. Of course, you have to take medicines if your cholesterol is above certain limits. For example, the normal range limit we say is around 200 milligram. But if it is very high, above 200, then yes, you have to very high, say 250, 270, etc. Along with the cardiovascular disease history is there. Then you have to know the score where you stand, and then accordingly you have to start medicines. You have to consult a doctor and start the medicines. Then one of the other diseases which you have to look out for is diabetes. Diabetes is usually present, the type 2 diabetes is usually presenting even at an younger age group. Usually diabetes present in persons who are really fat, because their BMI is very high and their abdominal circumference is very high. So that is one of the conditions for that is predisposing to diabetes. And sometimes, if you can, for example, if you take a test called HbA1c, which actually measures your diabetic value over a period of 3 months, and if it is, the value is about 6.5, yes, you are diabetic. And if it is 5.7 to 6.4, then you say you are in a pre-diabetic stage. If you can find out your value in a pre-diabetic stage, you can change your diet pattern, and you can include exercise in your daily health routine activities, and then you can actually go back to the diabetic. You can for some persons there is a new concept called diabetic reversal, and you can actually go to a state where you don't have diabetes at all. And if you are having diabetes, say if your random blood sample is around above 200 after 2 hours of food, that is postprandial blood sugar, and your FBS is above 110, and your HbA1c is also say 7.58, etc., then you are diabetic. That is where the test comes in, and that test actually, and that time, helps you to understand if you are diabetic or not. Then you have to go for a diabetic diet where you cut down your calories, minimize your calories, and then you increase your consumption of proteins. In your diabetic diet, you have to include your proteins like legumes, grains, pulses, etc. That's a major source of proteins. And then you have to include leafy vegetables. All the vegetables that grow above the ground level, that is something which you have to include in your diet, not the vegetables that grow below the ground. So above the ground, all those vegetables you can include in your diet. You can include a lot of water in your diet, and then regular exercises, and taking medicines at the correct time. Like some medicines have to be taken half an hour before food, some after food, some along with food, etc. So just consult with your doctor. You have to know how many calories you are consuming, and then according to that you have to have a diet plan for diabetes.